Our system, 20 years ago was in the ICU. And now we're basically at the morgue.
The Federation of Quebec Medical Specialists is demanding independent arbitration in its stalled negotiations with the province. But Health Minister Christian Dubé argues arbitration could mean nearly $2 billion in added costs.
I'm telling you that 20% of a salary of $9 billion, Quebecers have no way of having a salary increase of $1.8 billion.
We've asked for independent arbitration, like it happens in Ontario, in California, other jurisdictions. We've asked for that. I just heard the minister saying that he won't go there because it's too costly. I wonder what has been so costly since we had negotiations between parties.
Late in the day Wednesday, Health Minister Christian Dubé and France-Hélène Duranceau of Quebec's Treasury Board met with media, saying that Monday she met with both federations' presidents. They share the goal of providing the best patient care, and while mediation is underway, Duranceau says they have asked that pressure tactics be paused, to which they await a response. On Tuesday, family doctors voted to suspend teaching medical students starting October 1st, joining specialists who've already taken the same step in protest of Bill 106. The proposed law would link part of doctors' pay to performance targets, fueling growing backlash across the medical community.
We need to incentivize, encourage doctors, family doctors to work more, continue to work, and train new doctors. We need to incentivize and not coerce.
But doctors warn the government's plan pushes speed over quality.
You can't put it into a box and say we're going to link doctor remuneration to the time spent with the patient, because the patients need more time today. We're not dealing with the same patient we had 15 or 20 years ago. The population is aging. Patients take more time to evaluate.
Patient advocates argue Bill 106 treats healthcare like a factory floor.
In terms of quality of care, do you push doctors for performance? This is not a machine shop. This is not a manufacturer. It's about patients. I would ask doctors to be even more, not lengthy, but slower with patients. Listen to them. Care for them. Do the complete job that has to be done.
And they warn the longer this standoff drags on, the more difficult it'll be to attract the next generation of doctors.
As we speak now in Quebec, the law of the land is that doctors cannot go on strike on the shoulder of the patients. They cannot affect the patients. Short term, we're fine, all right? Because they're not touching patients. On the longer run, yes, something will have to be done because new doctors will not be coming in and will not be able to help the patients.
The Federation of Medical Specialists are meeting with the presidents of 36 local associations Wednesday night to set their next steps and pressure tactics. And for patients already struggling to access care, the stakes couldn't be higher. In Montreal, Lola Kalder, City News.